John Curran, please accept question 72.
Minister, Budget 2019 announced a couple of weeks ago in the House saw an increase of funding to €75 million for the National Treatment Purchase Fund. My question to you this afternoon is, what additional procedures and treatments would be provided in 2019 as a result of the additional funding?
Sir.
Thank you, Deputy Curran, for this important question. Reducing waiting times for patients for hospital operations and procedures remains a key priority. In Budget 2019, as the Deputy correctly says, we have further increased investment in this area, with funding to the National Treatment Purchase Fund increasing from €55 million in 2018 to €75 million in 2019. That is an increase of over 150% since this government came to office, since the Confidence and Supply Agreement was entered into. In 2019, the NTPF plans to deliver 25,000 inpatient day case treatments. That's an increase of 5,000 from the 20,000 procedures committed to in its waiting list action plan this year. In addition, provision of 5,000 gastroscopes will be arranged by the NTPF. That's an increase of 1,000 from their target of this year. Furthermore, 40,000 first outpatient appointments will be arranged. I think this is a really important point. We have made a lot of progress, and in fairness, I've heard your own party acknowledge this. When you look at the inpatient day case list, we have seen a very significant reduction from about 86,000 at its peak, people waiting for hospital operations or procedures, to now down to the low 70,000s and projected to continue to drop month on month. So we know the investment's making a difference there. The area we now need to target is outpatients, and that's why I will be putting a particular focus in terms of the resourcing of the NTPF on those 40,000 first outpatient appointments. This year has seen ongoing improvements with the number of patients waiting, as I've said, for an inpatient and day case procedure. Now it's 72,700 from a peak of 86,100. That's a 16% reduction, and continuing for that reduction to grow in size. The number of patients waiting over 9 months has reduced from over 28,000 to under 19,000 in the same period. That's a 32% reduction. And it's expected that through the combination of HSE and NTPF activity that this trend will continue. And it's expected that the overall number of patients on the inpatient day case list will reduce to around 70,000 by the end of this year and to under 59,000 by the end of 2019. NTPF activity next year will cover approximately 50 high to medium volume procedures, and will be through a combination of treating patients in outsourced facilities and public in-source facilities. I will publish a waiting list plan with the NTPF detailing that, but there will be about 50 high to medium volume procedures that will be targeted in 2019.
Thank you, and thank you for the reply, Minister. In the opening part of your reply, you mentioned that the spending this year has gone up by 150% from what it was a number of years ago. Yes, it has, because it came off the back of a very low base. I'm glad to see you acknowledge and to identify the procedures that are being carried out. I suppose I make the point, and I don't want to play politics with it, but I want to be very serious about it. A decade ago, we were spending more than that, and than the 75 million on the National Treatment Purchase Fund, at a time when the total health budget was considerably less than the 17 billion it is today. And I suppose the concern I have, Minister, is you've quite rightly identified the various procedures, including 40,000 people on the outpatients list that can be targeted this year. I'm concerned that you're not ambitious enough for the National Treatment Purchase Fund, where we have over the last number of years, where these lists across outpatients and so forth, the lists have grown and grown very significantly. And there is an opportunity, in my view, to I suppose, be more ambitious, and to, I would have hoped that the National Treatment Purchase Fund in this year would have been more like 100 million rather than the 75 million, that we would have had a really ambitious programme. And I say that on the day when the Taoiseach stood where you are at the moment, and he said, if anybody has any suggestions for the extra billion in health, please tell him. I'm suggesting a small portion of it might well be directed to National Treatment Purchase Fund with very specific targets, Minister.
I'm not going to play politics with this either, because I accept Deputy Curran's bona fides in relation to this. I would just make the point that the Confidence and Supply Agreement did commit to €15 million. So I think, in fairness to both your party and the government, I think we're doing more than we said we would do together through Confidence and Supply. I would make the point, and I think the Deputy would recognise this, that the funding to the NTPF is not the totality of funding on waiting list initiatives. In fact, it's still very much at the margins. As you rightly say, the HSE has a budget of over 17 billion, and I do like to make the point, particularly when Deputy O'Reilly is here, that it's not all for outsourcing either, that an awful lot of it can and should be in insourcing. And I've met all of the hospital groups in recent days and weeks, and I have said to them, please put forward your proposals for insourcing. And for example, we've opened a cataract theatre in Mina as a result of that. I would also have to make the point, because I hear this an awful lot, not from you, Deputy, but I would make the point that outpatient waiting lists weren't published up until a few years ago. So when I keep on hearing people say record high, they're not actually comparing like with like the figures previously were never published. We have seen a lot of progress, for example, in relation to cataracts. At the end of July 2017, we had 10,024 people on the waiting list. That's dropped to 6,626 at the end of September. So we have an awful lot more to do in relation to this. I'm always happy to allocate more funding in this regard, and we'll work our way through this in the service plan.
Minister, and I know some members of this House have an ideological viewpoint that they're opposed to the National Treatment Purchase Fund. I look at it, I suppose, from a pragmatic point of view, that it delivers a service for people who are currently waiting on lists. I do think that you should consider being more ambitious in terms of what's available, and I think we need to consider extending the services enrolled. That it might, so for example, specifically, that we might look at the role that it could play in terms of providing services for children, and by that I mean children who are diagnosed, who require diagnosis, whether it's in terms of occupational therapy, speech and language, and some initial treatments. Some of those waiting lists, as you know, for a young child are unacceptably long, and I believe that a targeted approach from the National Treatment Purchase Fund could have a role to play here, and I think it should be examined, Minister.
Just like Deputy Curran, I don't approach this with an ideological viewpoint. I very much see the National Treatment Purchase Fund as an agency that should be seen as an access fund, a way of making sure that we can have ring-fenced budgets to ensure that our patients can get more timely access to treatment, be that inpatient or outpatient. I am ambitious in seeing the NTPF extend its remit to outpatients. We do need to do that in a careful way, in a way that we make sure that if it is outsourced, that they look after the entire episode of care, that you don't just see someone on an outpatient list and then refer them back to a public hospital list for an inpatient procedure. I agree with you in relation to the assessment of needs issue, and as you know, we have funding in budget 2019, which Minister McGrath now will reflect in the service plan for 100 additional therapist posts. And I certainly don't rule out looking at other ways of using the NTPF if it can be helpful.